Unvaccinated healthcare workers have two choices at this point: get the shot or lose their job. The only exception is workers can prove if they have a religious or medical reason to not get the vaccine. Tonight, we're learning more about how that process works. A Novant healthcare worker sent us these 8 pages of rules given to employees. They say the hospital uses them to determine who gets an exemption and why. The guidelines say requests to skip the shot will be reviewed by a vaccine exemptions committee. Novant Health says there are a few medical and religious exemptions that will be considered on a case-by-case basis. Over at Wake Forest Baptist Health,
we recognize this is for many folks, it's an emotional issue, trying to get past some of the fear.
Dr. Richard Lord says they've already received several requests.
I actually did one today for an individual who's had allergic reactions to the flu vaccine and was asking for a medical exemption, which was perfectly reasonable when they've had an allergic reaction. So I fill that form out and they then turn it in to employee health. Religious exemption, the individual, because they're going to know their religious exemption, they fill that out and they submit that, and then that will be reviewed anonymously by a committee.
Still, others say they shouldn't have the shot for any reason. There have been protests at hospitals across the state since several health providers announced they'll require employees to get vaccinated.
It's like a 180. We're heroes, but we don't really need you. I'm just not ready to get the shot yet.
Hospitals stress the vaccine is necessary to protect employees and patients.
We've got to be respectful of our employees and their concerns, but we also are asking them to recognize we're trying to look out as best we can for their safety.
The deadline for employees to get vaccinated at local hospitals ranges from September to October.